Hi, I am the Allied Health Faculty Chair and a member of the Simulation Council at Parkland College. One of our initiatives is to build interprofessional experiences between different health professions programs. This video follows one patient through the continuum of care provided by 4 different health programs. Angelo is a male patient who experienced a myocardial infarction. The first team member you will be introduced to is the paramedic student who arrives on scene at Angelo's home. He will be transported to the emergency department, which is when he will see the respiratory care student. He will then undergo a cardiac bypass graft in the operating room. The surgical technology student will assist the medical doctor in the procedure. Finally, he will be admitted to the hospital and will see the occupational therapy assistant student after post-op day 3. I hope this video is informative and allowed you to explore different allied health programs.
Sir, can you hear me? Sir? Okay. So he is breathing. He does have a pulse. Since we were called up for chest pain, Stucky, go ahead and start putting on his 12 lead so we can monitor his heart rate. All right. So his monitor is showing that he is having an inferior STEMI. So we're going to go ahead and get him on the stretcher and get him into the ambulance. Now that we're in the ambulance, I would like an IV. We're going to give him 325 milligrams of aspirin, as well as nitroglycerin, and some fluids on the way. Once all that's done, I'd like to go lights and sirens to the closest appropriate facility, please. The EMT basic or firefighter will get into the front of the ambulance and drive lights and sirens to the closest appropriate care facility. While en route, the patient may be placed on maintenance fluids. If they are having substantial amounts of pain, they will also be given pain medication if vital signs are within appropriate limits. Paramedic will need to keep the patient informed and calm and explain what's going on, what treatments we are doing, and what will happen when arriving to the hospital. While en route, you will have to reassess vital signs, look for any other injuries or treatments that may be needed. When the ambulance is approximately 5 to 8 minutes away, a radio report will be called and the EKG will be transmitted to the hospital.
My name is Marissa. I'm a respiratory therapy student here at Parkland College. So my role as a respiratory therapist in the care of a possible heart attack patient will begin in the ER of the receiving hospital. Our patient case is a subject who called 911 with complaints of chest pain and symptoms associated with the myocardial infarction. So this will be my care in that patient. Respiratory therapists work in the ED, the emergency department, and provide support to patients with varying conditions, in this case being a potential heart attack. My role will be to assess the patient, provide supportive oxygen therapy, which reduces the workload on the heart, and be on standby for the next steps, whether we're going to cath lab, surgery, if a code situation happens, whatever is needed. The patient may already be on an oxygen supportive device in transport to the facility, but if they're not, then I will go ahead and assess the patient and make sure that they're oxygenating okay. As the patient is being assessed through heart monitoring and labs, I will be tracking progress and watching the patient's O2 saturation through pulse oximetry on the monitor. I can anticipate that the patient will need an intervention, so I will prepare accordingly. Respiratory therapy likely won't be in the cath lab or surgery, but once the patient has open heart surgery, the respiratory therapist, me, will prepare for the patient to come back with an artificial airway, which will require setup on the ventilator until sedation wears off. I will assist in post-assessment of the patient and O2 therapy as needed while the patient weans from sedation. Since this patient is going to be a post-open heart patient, I will be more active in my role because of the post-procedure prevention that's typically given by respiratory therapists. This will include incentive spirometry, possibly breathing treatments, frequent assessments, and positive expiratory pressure therapy to help open up the lungs. Taking care of an open heart patient is just one of the many kinds of patients that a respiratory therapist will care for.
Hi, my name is Victoria. I'm a surgical technology student here at Parkland, and today we're going to be discussing a coronary artery bypass graft. So coronary artery bypass graft is a surgical procedure to treat coronary artery disease, which is the buildup of plaques in the arteries of the heart. As a surgical technologist, our point of care with the patient begins and ends in the operating room. The surgical technologist is responsible for making sure all instruments and supplies are prepared for the surgical case. The surgical technologist will set up the room to prepare for the case. This includes the back table setup and Mayo stand setup. While the patient is being anesthetized and prepped, the surgical technologist must keep a close eye on the sterile field at all times, ensuring that nothing becomes contaminated. The surgical technologist is watching the sterile field at all times before and throughout the procedure. It is extremely important there are no contaminations, especially during this type of case. Any contaminations can put the patient at risk of infection or other complications. From incision to close, the surgical technologist is passing instruments to the surgeon, the assistant, and/or residents performing the surgical procedure. The surgical technologist is responsible for making sure that the sterile field is staying tidy. Otherwise, mistakes can happen or something could be lost. The surgical technologist must keep track of all sponges, sharps, miscellaneous items that could potentially be lost or retained inside the patient. The surgical technologist and the circulator registered nurse perform counts together before and after the procedure. At the conclusion of the case, the surgical technologist will clean up the field and their back table and/or their Mayo stand. The instruments should be placed back into their correct trays and should be cleaned of any gross soil. The surgical technologist can help transfer the patient from the operating table to the hospital bed if help is needed. At this point, the patient is taken to the post-anesthesia care unit and the surgical technologist contact with this patient is complete. So I hope this information today gives you a better understanding of the roles and responsibilities of the surgical technologist.
Hi, I'm Kayla and I'm an OTA student with Parkland. Today we're going to be working with the patient to try to get him out of bed post-op. Hi, Angelo.
Hi.
How are you feeling today?
Kind of sore.
Oh yeah. Where are you sore at?
My chest area.
Your chest area?
Surgery.
Right. All right. Occupational therapy assistants help people develop, improve, recover, and maintain skills needed to complete daily tasks. In this scenario, I am helping the patient who has previously suffered a myocardial infarction and is 3 days status post-coronary artery bypass graft to rebuild the skills needed to safely be discharged home. Before the OTA can begin working with the patient, the supervising occupational therapist will need to evaluate the patient to identify areas of strength and areas of need. This is typically done through conversation, assessment tools, and observation. Once the OT has completed the evaluation, they will then write goals and a plan of care that will need to be met before discharge. The OTA will carefully read the evaluation and plan of care that the occupational therapist provides. Common areas of rehabilitation after a coronary artery bypass can range between individuals. Some areas that occupational therapy practitioners can work on with this patient are energy conservation and fatigue management, home adaptation, anxiety management, and occupational pursuits. Due to sternal precautions, I will help the patient learn to get out of bed without using their arms. While doing this, the patient will hold a stuffed animal in their arms to help ensure that they will not weight bear through their arms. In a hospital setting, we work closely with the nurses, respiratory therapists, doctors, and physical therapists to ensure the patient is getting the best possible care. The OTAs also work directly with family members or other people in the patient's support system. It is important to educate those around the patient so that they can provide support if the need arises.